Please welcome to the podium Dr. Kevin Yingling from the Marshall School of Pharmacy. Dr. Yingling.
I will say that I'm not smart enough to be Dr. Chafin and show you some really brilliant slides, but I am smart enough to acknowledge the fact that I am very encouraged to be with a group of people that want to make a difference. And I would say it's not just the people here in the front that want to make a difference, it's each and every one of you by being here tonight that want to make a difference in this battle that we have against addiction. I have 3 to 5 minutes, so I will speak very concisely and try to make my points as best I can. So some plain talk about naloxone and about over-the-counter naloxone. In the past several years, there have been many initiatives, mainly statewide initiatives across the country, but you now hear about it being taught nationally by congressmen and senators, and certainly locally, like we're doing here in Cabell County, about the use of naloxone. Quickly, what is naloxone? Naloxone was improved in the 1970s. It is a medicine that works very simply. You saw the slides on the presentation earlier. Naloxone basically blocks the effects of opioids or heroin in the brain. So not only does it block that euphoric feeling that comes from those drugs, but it blocks all those central nervous system areas that talk about respiration, not breathing, and eventually death. That's what the medicine does. There are no significant side effects of this medication. This medication has been used by many of us. I look across the room, I see many healthcare providers. This medication has been used safely and effectively in hospitals across America for many years, because there have been times in hospital situations where there would be an overdose of those types of medications. The medication, by brand name, just to help you not be confused, by brand name it's known as Narcan. We now have Narcan nasal spray. It's also known by the branded name Ivezio, which is an injectable medicine, very sophisticated, and leads you through exactly how to take that medication. And most of the medication in this country used in the matter of reversing overdoses has been generic naloxone used through kits that allow you to squirt it in the nose. Why? The medication is easily absorbed from inside the nose. And in fact, if you think about it, in any setting that you're in, the person who has overdosed has a nose. And so it's easy to squirt the medicine in their nose. Okay? Not very sophisticated. You got an applicator that goes on the end, you stick it in the nose, and you do it. Now I'm making light of that. It is a little more sophisticated than that. But intranasal kits and that type of product have been available across the country, and now we have branded products that we can use as well. Prevention of death by providing naloxone to lay persons, that is what we intend to do. I will quote to you a study from the CDC, the Center for Disease Control, looking at data from 2014, surveying programs like the one here in Cabell County across the country. They identified that 152,000 kits, we didn't invent this, we just brought it here, 152,000 kits had been provided, and 26,000 overdose reversals had been documented.
Wow.
Okay? So, picture for a minute, that's what's happening in Cabell County. So you heard earlier that there's been a reduction in the number of deaths from overdose. You'll probably hear sometime quotes talking about the fact that naloxone in one dosage form or another has been dispensed or distributed from the Cabell County Health Department, and you hear about reversal of death in Cabell County. The kits are effective, they're available, they reverse overdose, death from opioids. It is cost effective, it is safe. In the hands of more people, used correctly, you prevent death, and you allow that person to move into recovery and rehabilitation. It's that straightforward. What is over-the-counter naloxone? How is it that a medication can be used over-the-counter without a prescription from a prescriber? I'll just take a pause for a minute. You know of many prescription medicines that you can now go to your grocery store or your pharmacy and buy that used to be a prescription. What allows it to be over the counter? It is a safe medication, so is naloxone, and the person can follow the instructions, take it properly to get the benefit. Many of you will use medicines to stop your indigestion and heartburn. You can read the instructions, you can take it, it's a safe medicine, and you use it. Same thing with naloxone. Safe medication, and if you can be educated on proper utilization and use of that medicine, it's a safe and effective way to reverse an overdose or the potential overdose from an opioid or heroin. In West Virginia, 2 effective pieces of legislation have been passed, sponsored by the governor, supported by fine legislators like are here in the audience tonight. The first is Senate Bill 431, for those who like to write down the numbers and go back and look at them. Senate Bill 431 from 2015, and House Bill 4335 from 2016. The first bill passed, the first step, if you will, provided by our legislators, was to expand access to first responders so that all the people that are first responders, you don't need to list them, would have it available to them to be administered in an overdose situation when they arrive there. The second possibility from that legislation was that a physician who was willing to educate the patient could prescribe the medication in a specific way so that they could have the medicine. And that has happened in West Virginia. There are hot spots around the state. Dr. Aldis in the Panhandle is probably the one that's done the most with this, but there were very clear guidelines about what you had to do. He would invite people to come, he would educate them, and then once they were educated and he certified that, then he would write them a prescription and they could go and have it filled. And even that was difficult because it wasn't paid for by certain providers, et cetera, et cetera. But that was the first step. The second step, under legislation from 2015, would be what's being done here in Cabell County, which is that you can educate a group of people, you can certify that they've been educated, then you can provide to them the product or a prescription, and they can get that filled at the pharmacy, as long as you follow the guidelines of the 2015 Senate Bill 431 legislation. What's now possible under House Bill 4335 from 2016 is that you can be educated, like in a program here in Cabell County, or by your pharmacist, that's where we get to the over-the-counter part, or by your pharmacist, and don't have to have a prescription that it can dispense naloxone to you in one of the product forms that we've already talked about. So what that allows for is that a person or a family member or a friend who feels that having naloxone available to be most of the time injected in the nose or injected to the very sophisticated product, which is an injection into the leg, if they want that, and as long as they're properly educated, there will be a process for that. Right now, in West Virginia, the Bureau of Public Health and the Board of Pharmacy are writing the procedural mechanisms in order for that to happen. So don't run out tonight and try to get that. But very soon, the state will provide a mechanism to allow you to do that. I think I would like to highlight that what this county is doing and what this health department is doing and what many people are doing here is we are capturing a lot of good ideas from across the country. Project Dawn in Portsmouth, that is, Project Dawn is deaths avoided with naloxone. Project Lazarus from North Carolina. Many of the features of these kind of nationally known programs are now being brought to Cabell County to make a difference. One part, this is my shameless advertisement. Y'all ready for my shameless advertisement? The Naloxone program is part of the harm reduction program at the Cabell County Health Department. Your Cabell County Health Department is absolutely outstanding. And the best way for you to support that is to vote yes on the levy next month. It is the best bargain in the state of West Virginia. I want to make a couple of key points. You must have the education when this legislation is implemented. You must have the education through a program like Cabell County Health Department or by the pharmacist in order to get the prescription without, or get the medication without a prescription. I want to make one last point. I really think that it's important for all of us in this room, even the people that have spoken tonight, that we are at the beginning of solving this problem. If anybody walks out tonight and thinks that the problem has been solved, then I think they've misunderstood exactly what's happening. I'm going to make a point that I've tried to hold for many of the projects I've had in my life. Transformation is built on 4 principles. You discover, you develop, you disseminate, you deliver. We'll go back over. You discover, you develop, you disseminate, you deliver. So what's happening in Calhoun County is we have been discovering about this problem. We have been developing around this problem. We are now disseminating about this problem. Of course, we are delivering solutions for the problem. But I will tell you, as I heard somebody else speak tonight, we are constantly discovering, developing, disseminating, and delivering solutions for this problem. Thank you very much.
Thank you.